We're about to begin year 4 of open enrollment under the Affordable Care Act, or Obamacare. There's widespread agreement that the system as written cannot survive, but no agreement on how to fix it, and questions about whether any of the solutions politicians are proposing would do the job. Today, millions of Americans are left guessing about not only what's next, but what's now. It's thrown us into a state that one of our most favorite and accurate analysts has dubbed zombie care, and that's today's cover story. Are Americans required, with the way things are today, to buy health insurance in 2018?
Maybe they are, and maybe they aren't.
That's only the beginning of the lack of clarity surrounding America's current health care status. As far as you know, is Obamacare still the law, or what's the future about? Do you have any idea?
No.
Is Obamacare still the law? Do you have to buy insurance? Do you even understand what's going on right now?
I think it's just been really unclear coming from the White House.
There's no clarity as to what is going on, and they don't make the public knowledge easily accessible for people.
I think we could explain it somewhat. I know it's a disaster. I think most of us do. It's been a mess for 50 years, and they haven't helped it any.
Our best shot at sorting things out is by consulting Robert Leshevsky, an insurance industry advisor who's been incredibly accurate in his analysis from the precarious beginnings of Obamacare. It's been 7.5 years since President Obama signed the Affordable Care Act into law.
The law technically says that you have to have health insurance. If you don't have health insurance, you will pay a fine. But the Trump administration has told the Internal Revenue Service, that who is in charge of collecting the fines, that when people file their tax returns, if they refuse to say whether they have health insurance or not, the IRS should not pursue them. You technically have to pay it. Your accountant's probably going to tell you you technically have to pay it, but it's not being enforced.
If nothing happens, nothing major to change what we call Obamacare,
yeah,
what happens to it?
You know, I kind of call where we are with Obamacare now zombie care. I mean, it's just going to stumble along. A zombie's the walking dead. So Obamacare is still there. It's still walking around. It's still selling health insurance plans to people, but it has no chance in its present form of ever offering affordable and attractive health insurance. And more people are just exiting it and going uncovered because they can't afford it.
Is Trump correct that the plan that just failed, sort of partial reform and replacement, will be passed in January, February, or March?
No, no. We got two problems here. First of all, Democrats and Republicans aren't anywhere near close enough to each other to get anything done. Democrats, the holy grail is not going backward on the insurance protection reforms and the Medicaid expansion. For Republicans, the holy grail is to go backward on the Medicaid expansions and loosen up the insurance protections. So Democrats and Republicans are never going to agree here.
Today, all of us stand before you and proudly proclaim our belief that health care in America must be a right, not a privilege.
Can you describe in an easy sentence or two what single payer means?
Single-payer health insurance plans, such as the one Bernie Sanders is proposing, would have the insurance company become the government for everybody.
Under Medicare for All, the average American family will be much better off financially than under the current system, because you will no longer be writing checks to private insurance companies.
Bernie Sanders calls it Medicare for All, and that's an accurate and simple description.
Sounds like a good idea in some respects.
It sounds like a great idea, and Bernie Sanders says that if we do Medicare for All, people's premiums will be less. They'll likely not have deductibles and copays, or they'll be much less than they are. It assumes that if we just pay the Medicare fee schedule to doctors and hospitals, costs will come down dramatically, premiums will come down dramatically, and deductibles will come down dramatically. The biggest lobbies in Washington, D.C. are doctor and hospital groups and pharmaceutical companies. They all spend more money than anybody else lobbying in Washington. So how long do you think it would take for them to lobby much higher reimbursement rates from the government? And they would just come back to the piggy bank every time they needed money. So we would have a program that didn't cost less and didn't have lower deductibles and copays. It would be a mess.
President Trump talked about being able to sell insurance across state lines and that being a good practical solution, at least in part.
The time has come to give Americans the freedom to purchase health insurance across state lines.
What's your view of that?
Selling insurance across state lines and association health plans are the two dumbest ideas that have ever come out of Washington, D.C. and healthcare policy. And what they are is they're backdoor cherry-picking ideas. You bring this plan in stripped down, it attracts the healthy people out of the existing pool, drives the prices up for the people in the state domiciled pool. You've just rearranged the deck chairs on the Titanic. That's all you've done.
It seems like most of the solutions are oriented toward things that don't address the base cost of health care.
Well, wonder why our health care costs are so high. The health care establishment has been getting unlimited dollars from government, from employers, from consumers. They've built this incredible infrastructure now that's very expensive. And the only way we're going to make health care more affordable is to deal with all this infrastructure we've got and get it to an efficient place.
How are we ever going to make the healthcare infrastructure dial itself back?
We're going to have to do it over many years. In the private sector and the public sector, we're going to have to put them on a diet. It really is the prices we charge, and we're going to have to, in real terms, ratchet those back so that hospitals and doctors understand there's going to be less money in the years to come.
Here's the problem. I haven't heard of any proposal in Congress to address that.
There isn't a single proposal to address that. They're not even talking about it.
Why?
Because if you start talking about taking money away from hospitals and doctors, they are the single largest lobbies we have in Washington, D.C. The pharmaceutical industry, the hospital lobby, the American Medical Association, all the provider organizations. No lobby is stronger. These are incredibly politically powerful forces, but they just keep sucking more of your money.
Meantime, he says the zombie care form of Obamacare stumbles along.
Obamacare has had some significant successes and some significant failures. Obamacare is working pretty well for the lowest income people who qualify for Medicaid in the 31 states that have expanded, so they've got comprehensive health insurance. You've got low income people being able to afford pretty good health insurance plans because they're so heavily subsidized. But the middle class is just getting clobbered, both because they face huge deductibles and huge premiums. And the premiums are just going to go up. I mean, we're going to see premiums go up in 2018, typically another 15 to 20%. In many states, we're seeing 50% rate increases.
We recently heard from Senator Lindsey Graham on the Republicans' latest attempt at Obamacare replacement, which failed. We asked independent Senator Bernie Sanders for an interview to explain his concept of single-payer health care, but he didn't respond.